Let's see. Yes, back there. This lady right there. Yes.
And I want to know what your timeline is for universal health care coverage. I'm anxious.
Well, you're really in a difficult spot because as a single mom and as a sole proprietor, it's really hard for you to get insurance. You know, the health insurance companies, and I will use a term of art, rip off small businesses. They put you into little tiny pools, charge you as much as they can possibly imagine, and then just sit back and see what happens. And it's so wrong. So here's what we're going to do. I hope we can make a little bit of progress over the next year, although it doesn't seem as though President Bush cares to do that. He's vetoing the children's health program, so it's not likely he'll work with us. But as soon as I'm elected, I will start working across the aisle to make those changes that we need. You know, the health insurance companies last year in America spent $50 billion on underwriting so they could avoid covering people in the first instance, and then on fighting with doctors and hospitals so they wouldn't have to pay the bills. And they exclude a lot of people like you. So what we want to do is make sure nobody is excluded. I'm not requiring anything from small business. If you want to go into the congressional plan, you'll be able to get much lower rates than you could anywhere else. And as a single mom, I hope we can cover all of your children under the Children's Health Insurance Program and make it possible for you to have some peace of mind, because that's really what this is about. Now, I know how hard this will be. You know, it's easy to say, let's have universal health care. I've been down that road. And I know how hard the interests who don't want this will fight us. You know, they'll make all of the usual claims. And it's really interesting to me when I hear some of, you know, Republicans on the other side start beating the drumbeat of socialized medicine. First of all, that's not what I'm proposing. My plan is not government run, doesn't create a single new bureaucracy. It depends upon private insurance, but it regulates them differently, like we regulate financial institutions and like we regulate utilities. They're free market companies, but they've got to operate in a different framework. So under my plan, insurance companies can't deny coverage to anybody. They have to cover pre-existing conditions. They have to cover prevention. And those that don't want to do that, there still will be a private market, because they will only have to do that if they come into the federal plan. And if somebody wants to pay more than they should, well, there's always a market for that. But for the vast majority of Americans, we will finally have competition based on cost and quality. If we don't rein in the insurance companies, they will continue to be the tail that wags the American dog. And I believe that the time has finally come, because I have spent, more than a decade now, talking to business leaders, talking to labor leaders, talking to doctors, nurses, healthcare professionals. Everybody knows the system has to change. And everybody wants it to happen now. But we're going to have to stand against the tactics, the scare tactics of the insurance companies to make it happen. We're going to have to take them on. I've offered them a new business model. They can stay in business, but they have to start actually providing health insurance instead of causing our costs to go up because they won't take care of people. I think we can get that done if we are united as a country to make it happen. Thank you all very, very much.